Hello, I'll be presenting a comprehensive policy proposal aimed at strengthening officer mental health and wellness. Policing regularly exposes officers to traumatic incidents and chronic stress that can impact health, decision making, and public safety. Our goal is to build a system that protects officers, improves performance, and strengthens community trust through accessible, confidential, and evidence based care. National studies show that PTSD affects roughly 8 to 15% of first responders, with even higher rates of depression, chronic stress, burnout, and suicidal ideation. Between 2016 and 2022, more than 1,287 law enforcement and correction officers died by suicide, a number comparable to or exceeding line of duty deaths in many years. These challenges impact officers across all ranks and assignments: patrol officers, correction officers, and specialized units, and emergency dispatchers alike. There are three main drivers of this crisis. First, routine job duties involve repeated exposure to violence, death, and human suffering, which leads to cumulative trauma. Second, organizational culture often discourages help seeking. Many officers fear losing credibility, assignments, or even their careers if they ask for support. And finally, chronic job stress, from night shifts and fatigue to staffing shortages and public pressure, compound trauma exposure and accelerate burnout. Officer wellness is directly tied to officer safety and performance. Untreated trauma and stress impair judgment, slow reaction time, and increase emotional volatility. All these factors are linked to critical errors and harmful encounters. From a community perspective, wellness problems correlate with higher complaint rates and reduced trust. For agencies, the financial cost of lost officers through burnout, disability, or resignation is enormous, increasing recruitment and training expenses while worsening staff shortages. This policy treats officer wellness as a mission-critical priority, not just a secondary benefit. Our goal is to normalize mental health care just as we do physical health care. The policy removes punitive fears about seeking help, builds confidential treatment pathways, and embeds wellness into agency leadership practices. Healthier officers lead to safer, more stable policing environments and stronger public relationships. The outcomes we expect include reduced rates of PTSD, depression, and substance misuse, fewer suicides, stronger on-duty performance, higher retention rates, and measurable improvement in community trust. These benefits support both officer well-being and operational effectiveness, creating a win-win for departments and the communities they serve. Culture change must begin at the top. Leadership will issue formal directives stating that wellness is a priority and affirming that voluntary mental health treatments will not be used punitively. Clear, confidential protections are essential. Agencies will also publish annual wellness reports using aggregated, de-identified data to promote transparency and accountability. We propose direct contracts with trauma-informed clinicians trained specifically to treat first responders using evidence-based therapies like CBT and prolonged exposure. Officers will be seen within 7 days of referral. By doing this, we're eliminating long wait times that discourage early help seeking. The employee assistant programs will also be strengthened to offer confidential triage without notifying supervisors except in safety emergencies. Peer support programs provide trusted entry points for officers who hesitate to seek formal care. Trained peer responders will staff all shifts and serve as connectors to clinical providers. Peer conversations remain confidential and not part of personnel records. When concerns rise due to crisis levels, peers will escalate cases to clinicians immediately, ensuring that no officer falls through the cracks. Annual voluntary mental health screenings will help identify problems early before they escalate. For designated critical incidents, such as officer-involved shootings or mass casualty events, officers will automatically receive outreach from peers within 24 to 72 hours and clinical evaluations within a week. Stabilization leave is offered when clinically necessary, and importantly, The policy avoids outdated mandatory single-session debriefing, which research shows is ineffective. Policies must support recovery, not punish it. This includes aligning with PTSD presumptive injury laws where available, maintaining pay and benefits during treatment, allowing modified duty assignments, and developing evidence-based return-to-work plans. Officers should never fear personal or financial loss when accessing legitimate care. While clinical services are vital, they are not enough alone. Chronic workplace stress must be addressed systematically. This includes improving scheduling predictability, maintaining minimum staffing standards, enforcing overtime limits, and guaranteeing recovery time between shifts. Fitness and sleep hygiene programs complement these reforms to tackle key contributing factors to fatigue and mental strain. We will collaborate with academic partners to rigorously assess outcomes. This includes tracking clinical improvements, sick leave usage, retention, and operational metrics such as use of force incidents. Annual dashboards allow public transparency while protecting confidentiality. Continuous evaluation ensures that adjustments are driven by real data rather than guesswork. This plan unfolds across 4 different phases. Phase 0 builds leadership support, budgets, and policies. Phase 1 launches peer training, clinician access, and screening pilots. Phase 2 scales services agency-wide and implements scheduling reforms. And lastly, Phase 3 evaluates the outcomes, makes adjustments, and secures long-term funding to institutionalize the program. This policy leverages a combination of municipal funding and state or federal grants like DOJ COPS and BJA Valor funding streams. Staffing needs to include a part-time wellness coordinator, compensated peer responders, and contracted clinicians. Technology tools will handle screening, referrals, training materials, and performance dashboards securely. Peer responders will undergo 40 to 80 hours of certification training. Supervisors will be trained in trauma-informed leadership practices to ensure supervisors model supportive, non-punitive behaviors. Clinicians will receive orientation to law enforcement culture, and all participants complete annual refreshers with scenario-based learning. Strong partnerships are critical. Local mental health authorities and hospitals are needed to expand treatment access. Academic partners can handle evaluations. Police unions need to ensure officer buy-in, and community advisors are there to help build transparency and trust. Also, federal and state agencies may provide technical assistance alongside with grant funding. The stigma surrounding officer mental health is the primary challenge. Addressing it requires visible leadership support and peer companions. Funding is another obstacle. Blending grants and municipal investments reduces strain, while short-term savings from reduced disability and overtime can demonstrate ROI. Workforce shortages limit capacity, which is why implementation is phased and uses contracted providers for scalability. In the short term, we expect higher use of support services, improved post-incident recovery, and a reduction in the use of sick leave. Over the long term, the goal is strong reductions in untreated mental illness and suicide, improved officer retention, and demonstratable gains to safety outcomes and community trust. This is not a single intervention. It's a comprehensive wellness system aligned with DOJ, NIJ, and RAND best practices. It addresses trauma, stigma, and workplace stress simultaneously and builds accountability through data-driven evaluation. Few agencies have fully integrated all these components, which makes this policy both timely and impactful. All in all, mental wellness is essentially a modern public safety. A healthy workforce makes better decisions, builds stronger relationships, and stays in service longer. This policy establishes a sustainable infrastructure that protects officers and communities alike. Healthy officers create healthy and safer communities.